Today is National Rural Healthcare Day, and WRAL's health reporter Grace Haba has been looking into the ripple effects of hospital closures in rural eastern North Carolina. From more crowded medical facilities across the Triangle to the possibility of emergency responders being unavailable to help travelers due to increased response times. Tonight, Grace is taking a look at a possible solution underway in Martin County that could set a new precedent for rural healthcare in the United States.
Not knowing where to turn in an emergency. It's an uneasy feeling Martin County residents have grown to know well after these doors at Martin General Hospital abruptly closed last year.
Emergency happens, you're far away from everything, and we're out here in the middle of rural eastern North Carolina.
But now there's new hope to remove these chains and restore these battered signs. A potential solution lies in Martin General becoming a rural emergency hospital, or REH. The designation would allow for the emergency department to reopen and reestablish immediate care, as long as the average patient stay doesn't exceed 24 hours. The UNC Shep Center reports the model has already been used successfully over 24 times across the country. But so far, no REH exists in North Carolina.
It's both a tremendous challenge and a real opportunity that we face.
County Attorney Ben Eisner explained the efforts also mark a first in the entire country, as no hospital has ever closed entirely and reopened as a REH.
It's a daunting process, but one we're taking on and trying to be a real trailblazer for the country, because I don't think that Martin County is all that dissimilar from places in the Midwest or Southeast, name region of the country. There are rural areas with these legacy hospitals that are facing the same kind of challenges that Martin County has.
Financially, reopening could mean expensive upgrades for the building with a lifespan dating back to the 70s. Over 200 people worked here at the time of the closure. Getting enough of them to come back more than a year later could also prove difficult.
The hospital has been added on to several times over the years. County officials tell me if it does get a REH designation, it's still unclear exactly how much of this building they'll have to reopen. In Martin County, Grace Haba, WRAL News.
Just 3 weeks ago, Washington Regional Medical Center, about 30 minutes east of Martin General Hospital, also declared bankruptcy. To hear how response times have changed for EMS in Williamston and the concerns for beachgoers traveling through the area, you can find Grace Haba's full report on our website under the Health tab.